Mason, thanks so much for taking your time.
Absolutely. Thanks for having me.
Sure. So give us a bit of your background. Obviously, you're an athlete,
Right.
and kind of what kind of injuries were you facing? What kind of pain were you in?
Yeah, I've had 7 knee surgeries. Used to play professional football. So back
Seven
then, 7
knee surgeries?
Yeah,
Wow.
7.
Wow.
It was crazy. I've had microfracture surgery done, 2 ACL reconstructions.
Wow.
Yeah, so and the rest I call them oil changes, where they're just kind of taking out the fragments. So 2 hernia operations.
Wow.
And and then also I've had some concussions being a former football player.
Wow.
So,
So did that start in your high school years, the concussions? Or
I don't remember.
Yeah.
Yeah, that's
Was
a
it,
little
people weren't
joke,
really
right?
looking for it back then, right?
No, they definitely started younger, and the knowledge, not knowing what a concussion exactly was at the time.
Right.
If you saw stars, now it's classified as a concussion. So
Right.
how many I've had, not sure.
Wow.
Yeah.
So your body's taken quite a beating, and football's a pretty brutal sport.
Yeah, it was or is obviously still. They're doing a lot to try to change that a little bit, but yeah, and I played everything. If there was a ball, I was around it.
Right.
It was a lot of fun growing up.
That's great. So what kind of, because you're young, obviously, to be, experiencing maybe aches and pains and having all these surgeries, but you're a professional athlete too, which,
Right.
is kind of a package deal that goes with it. So what brought you to stem cells?
Well, I was up for a knee replacement at 28 years old.
Wow.
And I said, you know what, that's not where I want to go. I think medical advances will come around or what have you. And I just kind of dealt with it, lived with it for a long time, as a lot of my friends are doing now. And I actually married a medical lab scientist, and she was telling me about all the neat advances in stem cell therapy. And I had heard about different athletes and people that have gotten it done before. So I decided to look into it. And at the end of the day, I said, you know what, this is something that worst case, and if it doesn't work out, at least I tried.
Right.
And so I decided to do it, and it's been a very positive experience for me.
How long ago did you have it done?
I had it done 6 months ago.
So what were you feeling before you had it done as far as symptoms, and then where are you now?
Okay, well, yeah, I had excruciating knee pain. I wasn't able to go downstairs without holding onto the railings. I wasn't able to run anymore, hike anymore, do anything that really a 38-year-old should be able to do. So I decided that it was time for me to look into something. I mean, even bending down to pick things up off the floor, to take a knee to fix something in my car, just around the house,
Right.
not able to do it anymore. And it got so bad that I just decided it's time.
Wow. So you came in, you had it done. So where are you now as far as the knee?
Yeah, so I'm able to run on a treadmill. I just did an incline yesterday on my lunch break. I actually did some running, and I'm hiking. I'm doing things in the gym that I haven't been able to do in years.
Wow.
Yeah, it's really changed my life, and it's also changed the life of my wife, because we're able to do a lot more things together now, such as hiking, such as we love to travel.
Right.
So traveling can be kind of a pain,
Right.
carrying things around and things like that. But I'm able to do it, and it's not nearly as painful.
Yeah, I think that's a part of the ripple effect, is that it's not only just, okay, you and pain is less, so now life is better, but it really does have an impact all around your life as far as, where you can go, your spouse, how you can, do things together, etc. Did the results meet your expectations? Are they better than what you were expecting?
It's a great question. Everybody says they can fix my knee. Okay, everybody's told me that. So when I came to stem cell therapy, I wasn't expecting too much. I was just thinking, you know what? My wife says it's supposed to work out. I've heard a lot of great stories. Let's do this. And I was at about a 10. It was pretty painful, pretty excruciating, and I wanted to be down 30%. I was good at 30%.
Like just take the edge off, basically.
Take the edge off.
Yeah.
Let me do some of the stuff that I want to be able to do. Let me golf again.
Right.
Let me be able to shift my weight onto my knee. Let me be able to do that type of stuff that, like I said, a 38-year-old should be able to do. But now I'm down to a 5. Like, I'm 50% better.
Wow.
And yeah, it's crazy. I didn't expect it. I'm super excited for it, obviously.
Yeah.
And I have friends and family now that are noticing activities that I'm doing that I haven't been able to do in a long time. So it's really neat to see other people take a notice also.
How long before you started noticing some difference in your knee?
In my knee, it was about a month. Now, I was the common term bone on bone, right? Even though I had some meniscus in there, the doctors would always say bone on bone. It took me about a month because of the degeneration that's been done in there, especially on the lateral side.
Right.
But once it started happening, and I took it easy. I listened to the doctors and said, hey, don't go out and go crazy just because you have stem cell therapy. Let them do their job.
Right.
So I was very excited to let them do their job, but then I really started noticing when I would do a walking lunge just to be able to see if it would work. No weights or anything.
Right.
And it was a little bit less pain. And then a month later, a little bit less pain.
Wow.
And then I got nervous to be able to try doing other exercises or maybe doing some hiking because, as you know, when you're hiking, on the way down can cause a lot of load, right? That's the tough part. But I started testing things out, and then I would be more sore everywhere else in my body because I haven't done that in a while, but my knee wasn't swelling up anymore.
Wow.
Yeah.
Wow. Well, that's interesting too, because the pain is one thing, but of course, that's many times accompanied by swelling.
Yeah.
And you're saying that the swelling was reduced also,
Yeah.
or you weren't seeing swelling.
Yeah, there wasn't any swelling.
Wow.
That was the most powerful thing for me. Because with swelling, if I wanted to do something prior to my stem cell therapy, it was a sacrifice. Like, let's say I wanted to try to go skiing, and this is years ago.
Right.
I would know that it was going to be a 3 to 4 day recovery just to be able to feel normal again.
All right. You had to pay the price.
Pay the price. Yep.
Yeah.
Had to sacrifice a little bit.
Wow. And I guess, because normally people having knee issues, they're decades older than you.
Right.
But at your age, this is the time when you're supposed to be enjoying all this stuff, especially, right?
Yep.
So pretty amazing results. Is there anything else you noticed? Because you obviously your body's been beat up
Sure.
from professional sports. Is there anything else that you've noticed that changed in your body other than your knee?
Yeah. Along with my knee pain, I was also having a lot of tendonitis issues in my wrists and my elbows. And to do a lot of the daily tasks that we all take for granted, especially at 38 years old, was getting annoying too. I didn't really notice it going away. My wife did, actually, because she noticed I wasn't cracking as much. I wasn't asking her to do some things that usually I should be able to do.
Right.
And that was nice. And then I realized, wow, my tendonitis is gone. In the gym, I'm able to do a lot more things. Right. Obviously, if your tendonitis in your wrists and elbows are gone, you can do things like that. So I call it the side benefit of having my knee injected, and the therapy into my knee has been phenomenal.
Well, and this is interesting because a couple of people have mentioned this almost the same way you did. It's like they started to notice, or they didn't notice that pain was gone in other areas until they remembered, oh, wait a minute, this used to hurt, and I'm realizing I'm not having this type of pain anymore. Right. And I guess, because a lot of times people would say maybe this is a placebo, maybe it's in your head. I think as extreme as your pain was, et cetera, we could rule that out.
Right.
But when you're not expecting these other things, that also sort of lets credence to the fact that there's things going on that we're not just believing, but are actually happening and having an impact.
No, you're right. And with the placebo effect, I didn't really feel anything like that because, like I said, it was about a month in my knee until it started feeling better. So any kind of real placebo effect would have been gone anyways.
Right.
And I understood it was going to take some time. Right. But yeah, the other things that have been benefited from it, and like you said, the things that I don't know that could be happening, like my heart, my organs, my brain, so the plaquing going on in there. We as former football players have a lot of plaquing going on. Yeah. So hopefully it's doing its job up there, but time will tell, obviously.
Mason, I understand you're not the only one in your family who got stem cells. So your wife got stem cell therapy also?
Yeah, she did. We were getting my treatment. I was getting my treatment in my knee, and we were talking. And she understands, being a medical lab scientist, about how stem cell therapy can work. And we were having a problem ovulating, and that's a hormonal issue at times. And so we decided to go ahead because she also has heart disease in her family. Her father passed away of a heart attack at 62 years old. Wow. So we decided to be proactive with it. And yeah, it's been really crazy. She hadn't ovulated and hadn't had a regular cycle in years. Ovulation, like regular cycle in like 10 years, but ovulation really ever.
Wow.
Yeah, so we decided to put her through stem cell therapy, and she just did, the IV, and we were able to, so we're ovulating now. And it's about 3 months. 3 months later, she started ovulating.
Wow. So literally after never having ovulated.
Yeah.
And that's really interesting because now you're kind of extrapolating, saying she didn't have any real pain, but you just knew of this hormonal issue, through, I guess, examinations.
Yeah.
And then they just did kind of systemic, just an IV injection.
Yep, that's it.
And 3 months later, it's happening.
3 months later, it's happening. We actually got pregnant, and then we lost it, 6 weeks later. But we kind of knew that she was high risk to lose the first one.
Right.
And but we're super positive. She then ovulated again the next time.
Wow.
So yeah, we're really excited for the future.
Wow. So that was probably something you didn't expect when you were getting your knee handled.
No. It definitely was a combo deal. She being the medical lab scientist wanted to see how everything's done.
Yeah.
She was just curious. And when we were talking, we're both a glass half full type of people.
Right.
And so we're talking with the docs, and they're having this medical conversation.
Right.
I don't really know these words they're throwing out pretty much.
Right.
But they're having this medical conversation, and I just felt it. I said, you know what, you're getting on this table next. We're getting treatment for you too. And she got really nervous because she's never had the treatment either.
Right.
But it was a simple process for her, and she's we are really excited.
Well, I'm looking forward to your future family.
Yeah, thank you. Hopefully another one of her. I don't know if they need another one of me, but we'll see. So thank you.
Well, that's quite an extraordinary story. Really happy for you to get all this activity back, and thanks so much also for just sharing it with us and letting people know about it.
Yeah, absolutely. Thank you. It's been an awesome experience.